Assalamu alaikum, everyone. Welcome to the BMAG podcast. My name is Adil Khawaja. If this is the first time you're watching the podcast, our aim is to promote and raise the profile of organizations and individuals who are working on issues affecting the Muslim community across the UK. Today, we'll be highlighting a fantastic organization that works with healthcare professionals in the UK to promote a better understanding of Islamic values and principles. But first, we have reached day 107 of the war on Gaza. I'd usually start by reading off the statistics about the latest death tolls and the unimaginable suffering and humanitarian crisis that is ongoing in the war on Gaza, whether it's the millions are displaced or the millions facing food insecurity. But today I'd like to do something slightly different and talk about one of the stories um, behind the statistics. Stories like Dr. Muhammad Mahmoud Amin Shaheen, who's known as the oldest pharmacist in Gaza. He dedicated his life to work in the first pharmacy in Gaza. Dr. Muhammad Mahmoud Amin Shaheen, known for his elegant appearance with his long white hair and green eyes, he was a pillar of his community. He lived through the Nakba of 1948 and was displaced from his village of Al Kubayba. Refusing to be displaced again, he was determined to stay in his homeland. But on the 21st of December 2023, he was targeted by an Israeli airstrike and was martyred while walking through his neighborhood. Our thoughts are with him and his family, and with the over 25,000 Palestinians who have died since October, and including 9,600 children who have been martyred. Dr. Muhammad was one of many healthcare workers in Gaza. After 107 days of war, the medical staff are exhausted, and there's an increasing concern about the humanitarian crisis in Gaza after the collapse of the healthcare system created by the targeted destruction of hospitals and killing of healthcare workers. In December, it was reported that 300 healthcare workers had been killed since October 7th. And of the 36 or 35 hospitals, only 5 remain functioning. At this point, there's probably even less than that to cater for the 2.3 million population. Such is the situation there that pregnant women are forced to give birth in the streets as there is no room in the remaining hospitals, with reports such as this one from Doctors Without Borders of Maha, who, when she went to the hospital and found that delivery rooms were full, she returned to her tent, only to find out that she had to give birth in the latrines next to her tent. Attempts have been made around the world to raise the alarm about plight of the healthcare workers in Palestine to no avail. International aid agencies like MEP, Medical Aid for Palestine, have been flying out emergency medical teams to provide assistance. But even they are not safe, as reports of missile strikes just this week near their compounds left medics injured and needing to be evacuated. Healthcare workers in the UK have been holding vigils in solidarity with their colleagues in Palestine to help raise awareness of the situation in Gaza. The British Medical Association, who represent all UK doctors and medical students, released a position statement on Friday about the war on Gaza. After referencing Articles 16, 17, and 18 of the Fourth Geneva Convention, which makes clear that hospitals, healthcare staff, and the sick are to be protected during times of conflict, the BMA stated that it's alarmed by reports of attacks on medical facilities and healthcare staff. The killing of healthcare staff and patients is utterly inexcusable. This brings me on to the work of BIMA. Like I said earlier, I'm glad to have Dr. Arshad Latif with me. Assalamu alaikum, Dr. Latif. How are you doing?
Walaikum assalam wa rahmatullahi wa barakatuh. Thank you so much for having me. Alhamdulillah, I'm really well. Hope you're well too.
Thank you very much. Yes, alhamdulillah, I'm well. So just talking about BIMA and the work that you guys have been doing. So on the screen share I've got is some of the work that you highlight. BIMA highlighted during Islamophobia Awareness Month. Work such as raising the profile of Islamophobia in the NHS. And also you sent a letter recently about the ongoing crisis in Gaza. But just as a brief background, just if we could ask yourself to see what kind of work that you've been doing and let us know what BIMA does generally.
Sure. So BIMA, or short for British Islamic Medical Association, is the largest Muslim healthcare professional body, not just in the UK, but the whole of the Western world. We are an affiliate organization of FEMA, which is Federation for Islamic Medical Association, and has got branches in about over 40 countries. Um, we are also an affiliate member of Muslim Council of Britain, MCB. Alhamdulillah, to date, we have got 7,000 plus members,
Wow.
and these members come from various backgrounds, Alhamdulillah. So, doctors, pharmacists, nurses, paramedics, and we have got a student BIMA group as well, which is thriving, mashallah. Um, do a lot of work in community, especially those in Nottingham would know that we do a lot of community work. So that's just one stream of our work that we do. You might have seen our Lifesavers work that happens across mosques every year in September. There is the Ramadan, Healthy Ramadan campaign again, usually happens about a week or two before Ramadan commences. That too happens across various mosques up and down the country. We have conducted some seminars and awareness campaigns around blood and organ donation. And Nottingham was one of the cities that was chosen for it about 3 years ago. And we continue to work around awareness of other donations like stem cell donation. Um, we do have other teams as well. So in total, BEAM has got about 18 teams, and they
Wow.
all work on different streams. So cancer screening awareness. We have got the mental health awareness and support. So this is the community side of it. Then there is the well-being branch, so to speak, in which we have got student BIMA. The organization looks to support, this particular team looks to support and mentor and help network Muslim students up and down the country. We provide induction courses for newly qualified pharmacists, dentists, doctors. We have got a special group dedicated for women healthcare professionals, Muslim healthcare professionals. And for the last 3 years now, Alhamdulillah, we've been producing a journal of British Islamic Medical Association, which is for the first of its kind for the Western Islamic Medical Association. So it comes out every 3 months. Um, then there is the operation side of things as well. Of course, we need to run an organization which has got 7,000 plus members. So, we got the communications team, the conference team, which normally tries to hold a conference once a year. And we have got the public relations team, which works a lot of work around advocacy and liaising with NHS bodies. And so what started off about 10 years ago with a very small meeting that took place in Markfield in Leicester, Alhamdulillah, is now a budding and thriving organization of over 7,000 members.
Yeah, mashallah, it sounds like you're very busy, and you're catering to a wide range of activities and individuals and professions as well, which is really good. I got involved with BIM. I'm a pharmacist by profession, with the Lifesavers event in Doncaster actually. So it's really good to see an organization, professional organization, catering to the needs of Muslims as well, and providing these essential services. One of the questions I wanted to ask you as well is obviously you've been with BIMA for 7 years, um, and the landscape's changed obviously since then, and since October and with the ongoing crisis in the Middle East. What is there anything that you've noticed significantly that's impacting the healthcare professionals in the UK?
So when the strikes happened on 7th of October, um, uh, there was a lot of, you know, uh, caution, a lot of anxiety in the community, um, apprehension as well. And we felt that because of an organization which has got 7,000 plus members, we started getting reports of very little or no support for colleagues who were being adversely affected by it.
Mm.
As we know, this did not all start on 7th of October, but 7th of October events did make a huge difference because it led to one of the worst atrocities that is being committed in living memory by any nation against a people. And this is something that affected everybody, not just people in that region, but people who have got family and friends there, and also people who want to speak against the atrocities being committed. So we saw from the NHS bodies, the director of mental health, for example, NHS England, who wrote a really nice letter addressing the atrocity that had happened in Israel, but completely omitting any reference to what was happening on the Palestinian side. And she offered support for colleagues affected by the events in Israel, but had no mention of colleagues being affected by what's happening in Palestine. Similarly, we had letters from some other organizations sent out with completely unilateral messages, no mention whatsoever of the other side. Um, as things evolved over the next week or so, we started getting reports of colleagues being reported um, to their employers, threatened with dismissal, and being told to go home pending further investigation,
Mm.
just because they had tweeted something, just because of sharing some comments whilst they were at work about the current situation, or retweeting or reposting something that was deemed inappropriate by individuals, or who had then anonymously or sometimes openly reported our colleagues. And so hence, we called out a meeting of our core members. We have got about 100 core members in BIMA, and we decided that we should start a new team. So I've already mentioned we're inundated with work that needs to be done. So we created a new team called the Palestine Response Group. And one of the first thing we did was to get healthcare professional bodies, ethnic, religious, non-religious, um, to write a letter to the Prime Minister to try their level best to de-escalate the situation in Gaza, because definitely it's having a huge impact, not just for the people there, but also the colleagues here, and just on purely humanitarian basis, not being political at all. So a number of organizations, including non-Muslim organizations, signed that letter, and BIMA was the one who was holding the pen on this letter. We wrote a letter to the General Medical Council and 21 other bodies. So as I mentioned, we have got pharmacists in our group, we got dentists as well. We sent letters to the medical school council, for example, because there were a lot of medical students who were being reported.
Mm.
You might have heard of the incident that happened in London, for example, as well as in Leeds, where people actually were joining IDF and then posting pictures and videos from Gaza, from the front line, and sharing it on the WhatsApp group. So a lot of people, raised their concerns, but when they raised their concerns, they were being reported. So we wrote letters to all of those organizations. And you mentioned initially in the beginning about the BMA letter that came out,
Yes.
a really positive, alhamdulillah letter. But if you were to see the first letter that was sent out by BMA, it was akin to something that's coming out of, if I can use that word, Israeli state television, essentially ignoring the plight of the Palestinians or people who have got.
Very
Um,
one-sided. Yeah.
Absolutely, it was completely one-sided and completely ignoring the atrocities that's happening on the other side. So we wrote to BMA, which is the union for the healthcare for the doctors and medical students, and has got nearly 200,000 members in
Yep.
UK. And we raised our 8 concerns about the letter that they had sent out. And as in response to that letter, they offered us very graciously a 90-minute meeting in which we raised our concerns. And Alhamdulillah, Summa Alhamdulillah, this letter that you see now
Yeah.
is the end product of that discussion, which, as you mentioned, is pretty balanced, and it mentions all the international laws and
Yeah, I was
the
just reading it on Friday, and I was quite surprised at how much it does go towards the Palestinian side of the story, which is very reassuring for a Muslim and somebody who's affected by what's going on. I just want to take this opportunity to say that we have Dr. Latif here. There will be an opportunity to ask questions at the end of the initial stage. So if you have any questions, feel free to jot them down in the chat box. The Zoom call, because of limitations, at the 40-minute mark may disconnect, but you can use the same link to drop back in if we're continuing past the 40-minute mark. So please bear with us. I just want to ask you, Dr. Latif, as well about just stepping back a bit because you mentioned that you worked on the BMA and you responded to the BMA. Um, since the recent spate of attacks and the genocide that's happening in Gaza, I remember you mentioning about how BIMA really struggled to in the initial phases to get the support and the legal basis and a lot of the work done. Can you just talk to that about what you had to go through?
So our first two letters, the letter to the Prime Minister and the letter to GMC, these were open letters. And surprise, surprise, the day after, BIMA was on the front page of Daily Mail, and with a clear attempt to malign organization's repute, just like as the BMA leadership at the moment is being maligned for sending out this statement that you're talking about. We'll come to that later, inshallah. So hence, you know, uh, we approached and tried to seek help from our colleagues, with, of course, the professional support, which is, of course, lawyers, and there is a Muslim lawyers group. But the situation was so volatile, and it was people had really very little clue as to what can be said and what cannot be said. Our statement, as I said, got coverage by the right-wing media. All our accounts, Twitter, Facebook, Insta, were flooded by messages. Majority of them pretty Islamophobic. So we had to turn off all the message as the posting options, the comment section. So we had to turn off the commenting for our posts. And then we decided that we should approach the lawyers because we were being threatened by legal action for being anti-Semitic.
Wow.
And so, Alhamdulillah, after the initial difficult phase where we couldn't find much support, we had some really good support from certain lawyer groups who came forward and have been looking after every letter that we've been sending out.
Mhm.
Not just that, but also as part of our Palestine response group, we created a sub team which looked after specifically the concerns being raised by the Muslim healthcare professionals in the UK. As I mentioned, a lot of people were being threatened with dismissal, sent home without any pay, especially if you were doing a locum post. I can tell you one particular consultant in A&E who was working, and he was just sent home one day because someone alleged that they were talking about the current crisis in front of the patient, which was, of course, untrue, unfounded. But the first thing they did was that they dismissed the person and did not pay him for the period that he was off. So these are some of the cases we took on and got the support from our lawyers. We created uh, some initial guidelines for people who are being reported unfairly as to how to proceed, because a lot of people had no clue about what's going to happen. So they were called for meeting and without knowing what their rights were. So we created a 6-point poster. Initially, well, to be honest, emphasizing the fact that you've got a legal right for representation. So you should not really go into any of these meetings, whether they're formal or informal,
Mm.
without knowing the context to it, without being provided all the evidence that has been put forward against you, and also the fact that you are, you should really have a representation, somebody sit in and record and give you advice, and you've got a legal right to stay quiet and silent as well. And Alhamdulillah, because of that support, what we found was is that a lot of these meetings were more of a truth-finding mission.
Mm.
They realized that people had come in prepared, and that Alhamdulillah, turned out to be a really good thing for them in terms of their employment. There was one doctor who was threatened, who is an international medical graduate, who was threatened with deportation. Um, so her visa was cancelled, and we then supported her case by with the help of our lawyers, and Alhamdulillah, the deportation orders have been cancelled now, and the fight still goes on, of course, as I said, that, there's a
So
lot
this is
happening.
this is something that we've been highlighting in BMAG as well, raising the issues about Islamophobia. I know I mentioned previously in BIMA had an Islamophobia Awareness Month where you're talking about stories of healthcare professionals and their experience with Islamophobia, even within the NHS. So all of this obviously is tied into the responses of people talking about Palestine. So could you explain some of the work? Because you mentioned about the legal protection that you're now sort of getting for your members. What kind of work is BIMA doing on Islamophobia?
So as you mentioned, so November is of course the Islamophobia Awareness Month. So we conducted a survey, which got the highest responses ever. We do it on a yearly basis usually, and this time around we had nearly 700 responses,
Wow.
and the results are really shocking. They're really, really shocking. More than 90% people felt that they had to self-censor. Um, 70% people felt that they were not able to post anything that they wanted for the fear of repercussions. More than 50% people had experienced Islamophobia in one form or the other, in the weeks leading up to. And we're talking about November, and remember this incident happened in October. So just
Yeah.
in that small period, and this is just healthcare professionals reporting it all.
Mm.
So we are now finalizing the whole report. So it's going to be a well documented piece of evidence, uh, not just for the healthcare professionals, but of course for the wider Islamophobia work that we are doing with other organizations. Um, but alhamdulillah, what it led to was the formation of this support group. So we had alhamdulillah support from the lawyers, we had support from our uh, uh, chaplains and mental health Muslim groups. So we created a network of Muslim counseling services, which have been supporting our colleagues through this difficult time.
Mm.
Um, yeah, and so Alhamdulillah, it's been going well. So far, there is not a single person who has been dismissed uh, permanently. So cases are ongoing.
Yeah.
But alhamdulillah, support mechanism is working with the help of the lawyers that we have. And
It's amazing work that you're doing. Yeah, it's
alhamdulillah,
fantastic work because it is very, very needed because there's a lot of people that are, like you said, they're concerned to speak out, they're concerned to, raise the issues or even do work on this. So if knowing that there's an organization there that will be able to provide that assistance and even legal assistance if need be, and even on a mental health level as well. I know that you do a lot of work for the mental well-being of your members, so it's really important work that we wanted to hopefully raise the profile of today. Um, because of all this work that you've been doing over the last 3 months and for the last 7 years, um, is there any sort of key points or sort of any kind of goals or targets that you've come to that you want to discuss today, or that you feel like the work that needs to continue with for BMO or generally for either healthcare workers or the general public?
so what this crisis, and every crisis, for Muslims, and everything, whether it's ease or difficulty, we have trust in Allah subhanahu wa ta'ala. It brings something good for us. So what we learned from this crisis was the need for unity, and the need to establish and support our organizations. Um, Unfortunately, there is a tendency in the Muslim community as a whole, and also amongst the healthcare professional bodies, um, specifically, where we kind of have this mushroom growth of organizations, and this doesn't, not always, but usually doesn't lead to anything concrete.
Mm.
Having a body which is represented by 7,000 members, we can then go and challenge BMA, for example,
Yeah,
and make them change their statement. So I think, what we learned was we need to be unified more than ever.
yeah,
So that was the first thing we learned. The second thing we learned was that, as Muslims, we need to be more than doctors and engineers. There
mm,
is something amongst, especially if you are from a South Asian background, the only thing that you hear in your ears uh, the time you're about to go to university is you can only be a doctor or an engineer. or in some cases, perhaps a lawyer. We need, Muslim professionals in every field. And
Yeah,
that's where we realize the importance that, we need journalists, who is fighting the war in Gaza at the moment. There
exactly.
are no armies there. It's the journalists which are doing it, and people who are willing to then, expand on that, amplify those voices, and people who are articulate. You might have seen, one or two interviews which became viral. Why? Because these people, the one thing that they were blessed with was the ability to say things in a way that are effective.
Yeah,
So I think we need to, as an ummah, especially living in the West, think about, you know um, having those skill base, inshallah ta'ala. Yeah, definitely the financial sector, as someone just mentioned
yeah.
in the comments, and everything else, inshallah ta'ala, comes into play.
Absolutely. And yeah, this is something that we've been saying as well, that these are unprecedented times, but our response has to be unprecedented. So if there's things that you're capable of, or there's talents that you haven't been tapping into, then now is the time, and it's highlighting all these needs that we need to, as a community, work towards. So absolutely fantastic point. So I'm just going to open up to any questions now from the people on the call today. So if there's any questions, feel free to unmute yourself or drop a message in the chat box. And the time is running short, so I think we have maybe 5 or 10 minutes left on the call. So I'd like to open up for any further questions. There was something about a backlash for the BMA position, and somebody's left a document in the chat group. Um, you, Mahmood, if you'd like to just elaborate on that.
Well, if the brother is not
Hello.
happy to
Hi.
take
Hi
over.
Sorry.
there. Hi there.
Just walking. So basically, there's a big backlash that's going on against the BMA's position from other medical professionals, and essentially, this document is to highlight that we should support the BMA and their stance as an independent healthcare organization, but also to flag it up to maybe BIMA if they want to uh, issue support to the BMA's position, current position at least.
Thank you for the question. Yeah, I think that's we did kind of touch on it before, Dr. Latif. If you wanna come back to that.
So a very, very good question there. Um, as you know, this statement came out on the Thursday evening, Friday,
Right.
and there has been a big backlash, as you rightly mentioned, as expected. And one of the big reasons why, a lot of these organizations have not been speaking openly is because of the fear. You might have read that previously it was the president of the Royal College of Pediatricians who was targeted. She's a professor, very well known, and she had to then redact. She had to, redact her statement. Unfortunately, BMA leadership, we are hoping, inshallah ta'ala, is much stronger. They represent over nearly 200,000 members across the country. So as you mentioned, Alhamdulillah, we are writing to them. We have written to them privately. We are constantly in touch with their leadership. Um, we have started a campaign of an open letter, which has been signed by over 15 members of BMA already, just in last 48 hours, which is a letter of support to the BMA membership. Some people have threatened BMA that they don't want to be part of an organization which doesn't represent their values according to them. But we have kind of essentially played it back to them and said, well, we want an organization which is willing to, we want a leadership which is willing to speak up on humanitarian issues. Um, we are completely addressing this from a non-political angle. If you look at the BMA statement, it's not a political statement. It's a statement of fact. It's a statement to help the humanity at large, where they talk about helping the Palestinians and stopping the war immediately and getting the aid, the absolute urgent aid that needs to go in. They also talk about the hostage issue. It's just that, subhanallah, the facts and the truth has been so twisted and people who are in control of the narrative, and want to be in control of the narrative, don't want anything to go out, especially from leading organizations like BMA. But yes, Jazakallah for raising it that point, brother. We are supporting them both at an organizational level and individual level. So we have sent out that letter to all our membership, encouraging them to sign that and show their open support to BMA.
Perfect. I mean, thank you for that very thorough answer. We've got another question. Abdul Jalil, if you want to unmute yourself.
Yeah, Dr. Latif, that's absolutely fascinating listening to you on this, actually, and I'm in awe of your achievements and the kind of like sacrifices that you guys are actually making in terms of your careers by standing up to Gaza. Now, that's something that we as a community sort of need to recognize, and we need to sort of somehow help if we can. And I was thinking whether it would be appropriate for some kind of fund to be started up, so that in case of your BIMA members being victimized or having to defend themselves against litigation, that kind of stuff. So whether you'd considered trying to set up a fund that that the community that can support you, because without your guys sort of being the lead in terms of bringing sort of news out of Gaza and sort of letting us know about the good work you do. We can't lose good members, and we can't lose the BIMA being sort of disbanded because of people leaving. So that's my question to you, really.
Jazakallah khairan, Brother Abdul Jalil. Really pertinent question, to be honest, because we in BIMA, we are all volunteers. I'm the chair of the council in BIMA, and we've only got 4 paid members in BIMA, which are not volunteers. So we only got 4 paid members, and rest of it, all of the work that you've been listening to today is being done by the volunteers. And yes, it does come with a huge risk to the organization as well as to individuals as well. But what we have been advocating, and again, as I mentioned earlier as well, is the need to unify, and you need to strengthen the organizations. And how can you strengthen that? You can strengthen by becoming a member of BIMA, for example. We have seen a huge rise in membership requests of BIMA since the whole incident started. And just before the call, I was speaking to Brother Adil, sharing with him the contrast that we've seen in terms of output of various Muslim healthcare professional bodies in response to this crisis. So we had a meeting just 2-3 weeks ago where we were comparing our output to other Muslim healthcare professional bodies, and without naming anybody, we realized that Alhamdulillah, our output was around, when we looked at the social media and our website and the support that we've been sending out, we were sending something around Gaza, or the support of the current crisis and the effect that it has around Islamophobia, and raising awareness and supporting our colleagues. Fundraisers, as I mentioned to Adil earlier, that we've been helping MAP, the Medical Aid for Palestinians, also the MSF, Doctors Without Borders. We've been organizing seminars for our healthcare professionals who want to go and work in disaster zones. We've been working with PaulMed, for example, around sending colleagues to help, in areas where there is a possibility of sending healthcare professionals. So all of this required a lot of effort. But Alhamdulillah, what we saw was that our output, we were putting something related to this almost every other day or every third day. And we compared our output to other organizations in the Muslim healthcare professional sector. And the nearest organization that came up to us was an organization which had only posted 3 posts with regards to Gaza in the last 3 months. And that just goes on to show that it's so very vital to have the right mixture and support, mixture of professionals, because we are going into unknown territory here. There is a threat, as you rightly mentioned, to the organization, to our our careers as well. So a lot in line. So how can you support us? You can support us by becoming a member. Alhamdulillah, we've seen a huge rise because people have realized that there is an organization which is happy to speak for our membership. So those of you who are online or is going to be listening to this podcast later on, do go to our website, www.britishima.org. It is a website which is actually being revamped. So hopefully in the next 2 or 3 weeks, it will be a completely new outlook. So if you just go there and click become a member, you can become a member. If you are one of the 18 categories of healthcare professionals that we take on as BIMA members. If you are not a healthcare professional, you still want to support us, there is a donate option as well. So please feel free to donate, and inshallah, your money will be spent in the best possible manner.
Yeah,
For
go ahead.
all the efforts and all things you are doing for the Muslim community. I am an IMG doctors who moved to UK nearly 4.5 years to the UK. And I found as a Muslim from foreigner to the UK who came here, there was two things which was tricky for me to navigate my way, and highly appreciate it if the BMA can. You hear me?
Yes, we can.
Yeah. So if the British Islamic Medical Association can help, is first one, if I think there should be a course, even if it's like a free course for the new IMG to Muslim want to teach them about what they can do and what they can do in related to their Islamic perspective in the medical field, like example for termination of pregnancy, contraceptive pills, plastic surgery, transgender surgery, what's the law allow them, and what is their right regarding refusal to do unelective things related to that. This one bit, like I found it's really so tricky for us who are coming from an Islamic country to here to cope with and to know what's our rights, and the fear of being misjudged, or like the fear of being referred to the GMC in case we decide to refuse to do unelective things which we think is against our belief. This is one point, and the others I noticed. Like many of the Muslim IMG doctors, some of them are say being referred for GMC for misunderstanding or things. So I think it's wise maybe in the future if we can have a course for, like, if we can review the Muslim people who've been referred to GMC just to see what the kind of cases, and maybe to make like self-awareness or teaching course for the Muslims just to know what are the commonest reason for referral and how we can prevent our young Muslims being referred or being thanked or being affected by these claims. Thank you.
Excellent question there, Brother Majdi. I'm glad that you asked that. So in BIMA, as we were talking about in the podcast earlier, we've got 18 teams, and one of the teams is called the IMG team, so International Medical Graduates Team, which is solely dedicated to helping colleagues who did not graduate from UK, to help them come into the NHS fold, and to support them in those early weeks, months, and years. It is for some a very different culture. The language barrier, and they might know the language because you have to pass the English with a really good score, but knowing the language doesn't mean that you necessarily know the culture. And the culture also comes with some ethical issues, some religious issues, as you rightly mentioned, for healthcare professionals. So just to clarify on that point, BIMA does not and is not an organization which will issue fatwas, for example, as to what's permissible and what's not permissible, because we are not a body made up of scholars. However, what we do is we have got very close connection with an organization called CIM, a Center for Islam and Medicine. And we also run courses with a very well-established organization called like Al-Balagh, for example, which I am a part of as well, which runs courses for healthcare professionals, Muslim healthcare professionals working in the Western countries, and addresses the same issues. So sometimes it's the healthcare professionals who need more Islamic education and understanding around those difference of opinion. And sometimes it's more about knowing the law and also advocating for it. You mentioned a few things there. So termination is, of course, definitely one of those things. The rules around transgender and the medications being prescribed. There has been a recent attempt, for example, around a male circumcision. And there is a lobby which has been actively trying to equate male circumcision to female genital mutilation. So we've been working very closely with the relevant authorities around that, and making sure that our rights as a religious minority are respected in this regard. And so there's a lot of work that is going on and a lot of work that needs to happen. And so definitely would like colleagues like yourself, Majdi, to join BIMA and help us navigate those challenges now that, mashallah, you're in year 5 or year 6 of your training, mashallah. Your experience will come really handy. The last bit about the referrals, you are right, actually. One of the first colleagues, the Muslim healthcare professional who was referred to Home Office was an IMG, a Muslim IMG, who posted something on her Twitter, which she deleted afterwards, only after a few people had taken a screenshot of those messages. So there is a need for education. There is sometimes that false sense of reassurance that, in this country, you can say whatever you want to, but you have to be careful that, sometimes some certain words, certain statements can be misconstrued. They can be taken against you if you are not politically correct. So that for people who have been brought up in this country, they would know their limits, and they will happily and courageously challenge when their rights are being stamped upon. But sometimes some colleagues who come from abroad, they, in their naivety, cross those lines, and that has to be dealt with, and education is a big part of that. So Jazakallah for raising those points, and I hope that you will join the BIMA IMG team as well, inshallah ta'ala, to bring on those perspectives. And lastly, we touched on this earlier as well, but we are keeping a log of the cases that are being reported, whether it's to the local trust or to the regulatory bodies or to the Home Office, for example. And these will be shared, inshallah, in coming few weeks, initially with local media, with the print media, and inshallah later on in journals as well. So we're hoping to publish some of the work that has happened as part of the Islamophobia Awareness Month, for which we've got about 700 responses into some journals, inshallah.
I think we mentioned earlier as well that you have some documentations that you've been spreading across the social media platforms that may be helpful for healthcare professionals as well. So if we can get those, we will spread those on the BMAG events group as well for people to use. But definitely, if you are a healthcare professional, please consider joining BIMA. That's a fantastic organization. Again, just been highlighted by Dr. Latif. So I'm just conscious of the time, so we have gone over what we expected to be, which is great because the questions have been really, really engaging. I'd just like one last opportunity for anyone who to ask a question, and then we'll let Dr. Latif go. Brilliant. Okay, I think that wraps it up then. So once again, thanks for coming onto the podcast. Thank you all for joining us live. And again, if you've missed it, we'll be on our YouTube channel. Next week, again, for people that didn't catch it, we'll be hoping to have Wasif Mahmood, who's a lawyer who's been working on a lot of the cases since October the 7th, and potentially for some legal advice. And in future events, future podcasts, we hope to talk about the Muslim vote. All of the information will be on our BMAG events group, so look out for it on there and on our social media as well. So just goes to say, Assalamu alaikum, and thank you very much again, Dr. Latif. Take care.
Alaikum assalam wa rahmatullah.